What are the most important issues that we can deal with when looking at health care? We've had some states that have said they're not going to opt in to the current health care plan that's out there. I would be on board with those same efforts to say, look, we are not going to adopt socialized health care. North Carolina will fight it tooth and nail. I believe in limited constitutional government. I always have. I read the Constitution. I'm a lawyer. I understand what those words mean, and I understand they're supposed to mean certain things. How in the world we have bootstrapped the ability of the federal government to get into any and every part of our lives constantly is not constitutional. You cannot understand it from looking at the Constitution and from reading it. Anytime that anybody has to give you a long-winded constitutional argument as to why they can do something, somebody is lying. Somebody is trying to pull something over on you. Our founding fathers came here, developed this form of government, risked their lives and their liberty in order to form a conglomeration of states and peoples who did not want a strong federal government to tell them what to do, centralized in one place. And what do the feds do when they do things like that? Well, they pass all those costs that they possibly can back on the state. There's no free lunch. For some reason, politicians seem to think that there is, that you can just print money on the federal level, you can just spend dollars you don't have on the state level, you can just keep taxing businesses until they go out of business. Well, I don't believe those lies, and there's really three big ones. The government knows what it's doing, they can tax you into prosperity, and they can regulate you into riches. And I do not believe those things. And anybody who does, I have some wonderful swampland in the Green Swamp. I'd be happy to sell you that you can build on to your heart's content. I mean, it's just ridiculous. Those are lies, and they don't work in your own house. They don't work in your own life. They don't work in your own business. You wouldn't teach them to your children. Why do you believe them when politicians tell you that? Additionally, we will need to, when we're figuring out what health care should be in North Carolina, why can you only buy health insurance from Blue Cross Blue Shield or United Healthcare? What's that about? Why are there only two companies? The feds it may be mandated by the U.S. Congress, but it darn sure ought to be done here in North Carolina immediately. Allow people to buy health care in other places. Do everything possible to institute free market reforms. Do everything possible to encourage health care savings accounts, giving deductions to self-employed. There's a number of things we can do. The more we can encourage people to use health care savings accounts, which gives you an incentive to be healthy, to stay healthy, to do the right things, and you benefit from it, instead of just every reason to go to the doctor and spend money. I think that I know it does in my life. That's what I have. I mean, I'm as healthy as I've ever been, and I have an economic reason to be that way. Otherwise, I pay out of my pocket for it. So I eat a good diet, I exercise, I stay healthy, I don't smoke. I mean, I do all those things, not only because I want to live a long time and I like being healthy, but I have an economic incentive and a reason to do that. That's what we need to do across the board. That's just common sense, and we can all do that.